My name is Jeremiah Onovo and my student number is 19203773. I'll quickly run you through my outline of my presentation, introduction, overview of the reflection, definition of discharge planning, inquiry-based learning, objective of the assignment, my role in our case meeting, how I negotiated the role with my peers, the rationale for my choosing role in the case scenario, contribution to the collaborative active plan, action plan, support provided to the patient and the carer, interprofessional collaborative practice, accountability in clinical practice, leadership in multidisciplinary team, learning, application of action learning theory, limitations identified in the EBL section, strengths and areas for improvement, future learning goals and strategies, summary of the key learning points, final thoughts on the role of interprofessional collaboration. This reflection is carried out using the Driscoll reflective model. This is a critical reflection on the simulated case scenario activity, which we conducted the discharge planning best interest meeting role play during our inquiry-based learning trigger 4 group section for Elaine. Elaine, an other name mentioned in this presentation, is a pseudonym in conformity with the NMC Code of Confidentiality. We identify key learning takeaway and any future learning needs for collaborating with other healthcare professionals to provide evidence-based person-centered care. Discharge planning for individuals living with a mental health or comorbidity issue is defined as a process for identifying and organizing the service and connections a person with mental illness, substance abuse, or other vulnerability will need when living an institutional, inpatient, or custodial settings and returning to the community. The term comprehensive discharge plan is used to refer to explicit inclusion of collaborative arrangements between multidisciplinary inpatient and outpatient team. In planning for discharge, this healthcare team meet frequently and include both affected individuals like Elaine, their family carers, or families in the discharge process. Using the inquiry-based learning role-play approach, we collaborated from multidisciplinary team perspective. We conducted a discharge best interest meeting, thereby creating an environment of learning that was driven by the process of inquiry through the scenario trigger. And with the guidance of our facilitator, we, the student, identified our learning needs by making sure we created comprehensive intervention for our patients, examined the resources needed to research the topic stroke within the modules, and also external resources, thereby acquiring the requisite knowledge, because this experience is related to real life. The EBL experience is related to real life clinical challenges, and evidence has proven that any real life event or real life learning strategy makes the knowledge retained. The objectives and aims of this reflection. The objective of this assignment is to develop essential competencies required for effective practice in complex clinical environments, including critical thinking, teamwork, collaborative practice, accountability, delegation, decision-making, clinical judgment, and a solution-focused approach to addressing intricate clinical challenges. The EBL section was incorporated into our learning to enable us to build the skill we need to work successfully in today's complex clinical environment, including self-directed learning, teamwork, and clinical decision-making. The philosophy of EBL stems from the idea that developing and processing new knowledge requires the activation of prior knowledge. We, the students, were allowed to build on our existing knowledge through discussion, asking and answering questions, and applying prior knowledge to the scenario. Building on existing knowledge is designed to enhance students' recall, retention, and application of knowledge to nursing practice. I was assigned the role of a named nurse for the patient as part of my role, as part of our role rotation strategy, my role in our case meeting. The rationale behind the assigned role was based on the patient's care need after assessment. We assessed the patient using the Roper Hector activity of daily learning, which cut across 12 human functioning activity within the group of biological, psychological, sociocultural, environmental, and economical sections. Another assessment tool that was used was the Patient Health Questionnaire, which is the PHQ-9, and the ABC assessment tools was also used. For example, our 8 members in EBL group team was assigned different professional roles based on Elaine's assessments and her care needs, which cut across inpatient settings where she was under the care of psychiatrist, occupational therapist, a named nurse, and a psychologist, while her community discharge plan care needs also cut across the service of the social worker, care coordinator, community team psychiatrist, community psychologist, occupational therapist, relative, and her friends. The process allowed us to participate in a professional perspective and learn how their functions are carried out, how I negotiated the role with my peers. Role rotation was implemented as part of our group rules to enable group members to engage from various professional perspectives, fostering a holistic understanding of patient advocacy across different disciplines. For each trigger, the role were swapped across the EBL members so that no member took the same role twice on different triggers. But in the final trigger, we decided to make ballot for the role based on Elaine's care need, and also due to the fact that other members were complaining that some members were shying away from active roles. In this regard, we engaged in balloting so that whatever you pick becomes your role. So in that regards, I picked the named nurse and I functioned as a named nurse in this trigger 4. Rationale for my choosing role for the case scenario. According to the trigger 4 case scenario, Elaine was in the inpatient setting, which requires her to be assigned a named nurse according to the NHS application of primary nursing model from the 1970s. The primary nursing model states that a named nurse should ensure continuity of care, professionalized support, and clear point of contact for both the patient and their family to improve patient-centered care and streamline communication. For this reason, the Enquiry-based learning group rationalized the input of a named nurse as part of the MDT. MDT in the mental health care were introduced through the Department of Health and the Department of Health, and the title of that meeting was Planning for the Future Strategy in 1984. This initiative aimed to provide individuals with mental health challenges with holistic care by integrating social workers, psychologists, occupational therapists, mental health nurses, and psychiatrists into the decision-making process. Research has demonstrated that the MDT enhanced care quality by incorporating diverse professional perspectives into service users' care plan. My input when discussing the collaborative action plan. As Elaine's named nurse, I was concerned about her care and safety transiting to the community. I ensured her community care coordinator had all information required to safely care for Elaine by recording accurate electronic progress notes of her care using the SBAR, which is the standardized handoff protocol, and updated her risk assessment and care plan. I also ensured that all medical documents were properly scanned and documented in the electronic system. During our discussion, I was concerned about Elaine's discharge to the community. I suggested that she needed more care in the ward, with a structured routine to examine her recovery, as I had observed the new medication, aripiprazole 10 milligram once a day, was working better than the olanzapine, which was previously administered. However, the MDT, her sister, and the community team were happy to have her in the community. I listened to the MDT, Elaine's family and friends concerned, and the community team's plan during the meeting. It was a best interest meeting, as Elaine was assessed to lack full capacity to make a clear decision regarding her discharge. We plan to place Elaine on CTO of the Mental Health Act 1999 for easy recall back to the ward if non-compliance with treatment or further risk was observed, or in the event of an emergency. My contribution to support the patient and carer. During the best interest meeting, I was particular about Elaine's safety and care. I spotted safeguarding concern, as Elaine's sister, who is her carer, was unable to give the MDT clear availability to take care of Elaine's need. The MDT had asked Elaine's sister several times about her availability and how she intended to support her sister, but she was unable to clarify this issue. The MDT further requested the social worker to support her with a carer who would visit daily for further support, but her sister still was unable to clarify her availability. It became clear from the MDT rationale that Elaine might be neglected after discharge due to this development. The MDT suggested that Elaine remain in the ward while the social worker initiates further safeguarding investigation. The MDT and I suggested another option, which was to plan or place Elaine in section 117 if her home was no longer safe for her. The MDT meeting was adjourned for further discharge deliberation. So, the learning outcome of this module is to 1. Understand teamwork. Secondly, interprofessional collaboration. Thirdly, accountability, leadership, and learning skills, all in the context of complex care, caring for patients with complex care need or comorbidity. I will use the interprofessional collaborative practice IPCP and the interprofessional caring model as an evidence-based intervention to demonstrate my critical understanding of the unique role the health and social care professionals play in caring for people with complex mental health needs, and how we applied it in Elaine's care. Firstly, interprofessional collaborative practice, IPCP or ICP as some may call it, focuses on how healthcare professionals from different disciplines work together to provide comprehensive care. It emphasizes teamwork, communication, and shared decision making to improve patient outcome, while the interprofessional caring model ICM integrates the concept of caring into interprofessional collaboration. It highlights the humanistic and empathetic aspect of teamwork, ensuring that both patients and healthcare professionals experience compassionate, holistic care with a proven evidence-based approach for supporting people with complex mental health issues or comorbidity, which include physical and mental health problems, such as Elaine's. And this model was recommended by the National Institute of Health and Care Excellence in the UK. This model also supports the collaboration between the inpatient and community mental health team, transiting patients from inpatient to the community. Collaboration among healthcare professionals is essential in creating synergy to provide efficient, safe, and high-quality patient care. The synergy suggests that the outcome of productive collaboration between two or more teams or professionals are expected to be greater than the sum of their isolated effects. To provide the highest quality of patient care, healthcare professionals from different disciplines must collaborate. Applying the interprofessional collaborative practice, interprofessional caring model to the Enquiry-based learning role play has enlightened my understanding of this model and enabled me to maximize the learning outcome. I have developed the essential competencies required for effective practice in the complex clinical environment, including critical thinking, teamwork, collaborative practice, accountability, delegation, decision-making, clinical judgment, and a solution-focused approach to additionally intricate or to addressing intricate clinical challenges involving people, families, and carer to achieve optimum care and service outcome. I'll be talking about accountability. As a group, we made sure we took responsibility for our discussion and our decision as regards Elaine's care, making sure our therapeutic intervention was evidence-based. As a student transiting to practice, I recognize that my professional conduct is subject to the scrutiny of both criminal and civil court. I ensured that my practice is compliant with legal standards by following the Mental Health Act, Mental Capacity Act, NICE guideline, and other legal framework. Furthermore, as an employee, I will be obligated to adhere to my contractual responsibility of my employer by ensuring I follow the set guidelines and procedure of the organization. And as a licensed practitioner, I shall be accountable to my regulatory body or authorities for standards of practice and patient care by practicing effectively and upholding professionalism at all times. During our Enquiry-based learning section, we applied the transformational leadership style. Transformational leadership style is defined as a style of leadership that involves motivating and influencing others to create change. Transformational leadership inspires their peer and followers to perform beyond expectation. They create change within people and within multicultural organizations where individuals bring in their wealth of experience as an asset. The model is a perfect fit for the application of interprofessional collaboration practice, and where we, the team members, constructively criticize and motivated each other to achieve a unified goal. Learning. During our Enquiry-based learning, I noticed we maximize the action learning theories. Our question built the group dialogue and cohesiveness and developed innovative and systemic thinking and improved our learning results. Our group was able to act on the problem we were working on. We had also a coach who helped us learn and work smarter and more effectively, calling our attention to the subject matter. A critical appraiser. During the EBL section, some of the group members felt shy and embarrassed about asking questions in case they were wrong. In some cases, our group talk was very broadly around ideas related to the critical scenario we were discussing and did not focus on the topic sufficiently. During some of the trigger sessions, some of the team members were absent, which limited our team contribution. During the critical decision-making process, members of the team disagreed at some point, requiring evidence to support their decision. However, the ICPC model has its own limitations, which include the lack of clear role definition and understanding between professionals, inadequate training in collaboration, potential power and role imbalance within teams, time constraints for team meetings, organizational barriers to information sharing, limited awareness of other professional skills, challenges in coordinating schedules or meetings across different disciplines. What I did well, I was able to to understand my role as a named nurse by research and also commitment that is required for me. I was able to contribute effectively to the patient's case. I maintained accurate patient record for effective communication. I was able to accommodate other professional suggestions and intervention. I was able to identify the safeguarding risk regarding the discharge plan, and I communicated this to my team, which fostered our decision making. What I should have done better. I noticed I was emotional about Elaine's care, which could influence my judgment and possibly foster bias. In my future practice, I will empathize and I will be objective also to enhance my clinical judgment and decision making. Moving forward, I aim to refine my approach by implementing additional strategy to effectively manage communication challenges and patient engagement. This includes schedule meetings at times that accommodate therapeutic commitment. Furthermore, I will continue developing my knowledge of interprofessional collaboration to strengthen my ability to navigate through the complex care interventions, as it were. Thank you very much for listening to my presentation. Thank you.